everyone, welcome to Health Live at Seniors Today. It's that time of the year, it's raining a fair bit, but we have a session today based on the requests made in one of the sessions when I had spoken to some of you on dental implants versus dentures, making the right choice for senior citizens. And to conduct this session, we've invited Dr. Rajeev Narvekar and Dr. Asha Narde. Dr. Rajeev Narvekar has been on our session some years back around the time of COVID, and Dr. Narde has been on our sessions a few times. Let me introduce them before welcoming them. Dr. Narvekar is a leading prosthodontist and a dental implant specialist with a basic dental degree in India and specialty training in Philadelphia. He is head of the dental clinic at Breach Candy Hospital. His private practice in South Bombay is limited to the rehabilitation of oral and maxillofacial defects, intraoral treatment, including replacement of a single tooth to a full mouth reconstruction conventionally and with implants. About Dr. Narde, she is a conservative dentist and an endodontist. She has been in clinical practice in Mumbai since 95, and she has graduated from the Nair Dental Hospital. And she is also associated with the dental clinic at Breach Candy Hospital for over 2 decades. She is also part of the fraternity that trains young dentists in the field of geriatric dentistry to understand and provide for the needs of the aging population. Welcome, Dr. Narvekar and Dr. Narde. How are you all?
Thank you. Thank you, Mr. Maheshwari, for having us on your program. There's something that I do need to say to begin with is that Asha and me have been working together for the last 22, 23 years at the hospital. And a lot of it is just rehabilitating patients, initially with patients who have teeth and then subsequently with patients who have no teeth, and we place implants. So we have a huge relationship where that's been for the last many, many years.
Amazing. Doctor, can we have your presentation? And as always, do remember that sessions like these are advisory in nature, and in case you do have a problem, of course, you need to go and show your teeth to a doctor. And do remember that this is being recorded on July 25th, 2026. So in case you are watching this show after 2 years, do note that there could be some advancements in medical science, but fact of the matter is that if you need an implant, you need an implant. I'm not very sure whether anything new will have emerged after 2 years, but be that as it may, do update yourself with the latest in medical science, and most of it you will get in sessions on our Health Live series. Over to you, Dr. Narvekar.
Thank you.
So even as Dr. Narvekar has his presentation ready, do note that this is being recorded, and you can watch it again on Monday evening when we have it on our Seniors Today website. Yeah, over to you.
Okay. To begin with, just a little bit of history more than anything else is till the 90s, I think the dentures were the conventional way in which to turn around and restore teeth, replace teeth. And that was all that was there. And it is in the early 90s that we started placing implants for patients. It began basically with a situation where patients came to a point where it was becoming difficult and had an alternative to place implants to fix a prosthesis in the mouth, which would allow them to function as well as they do with implants. So the first thing was basically you look at a situation where you have all the teeth present in the mouth. These are stock images, and it's just for a representation more than anything else. And this is with a mouth which has all the teeth present. And from there, we just have a couple of slides which will show you a couple of teeth missing, and from there to a number of teeth missing. And then it's a question of how you restore these patients. So the most important thing more than anything else is implants began with a situation where patients had dentures on the upper and the lower jaw. The lower very rarely fit because it wasn't comfortable. There wasn't sufficient bone available. And so implants were designed only for the lower jaw. And after a number of years, when they found that the treatment was predictable, that's when they shifted on to the upper jaw, which has slightly softer bone. And from there, subsequently to a little more sophisticated approaches for single tooth replacement and 2 or 3 teeth replacement at the same time. And of course, today we have a huge number of procedures which you can use for grafting and developing the bone also. This is the main thing. This is the image that I wanted to show everyone. This is a patient who has all the teeth present, and if nothing is done, that's what the patient leads to, with a loss of not only the teeth but a subsequent amount of bone that is lost along with it. And that's what happens not only to the function but to the form of the patient and the general health of not being able to eat at all. Same situation again. This is the denture that's provided for the patient. And these are implants to give the patient a fixed prosthesis, a fixed bridge on which they can function. So two options. When you're missing a single tooth, what you can do, you can actually turn around and prepare the two adjacent teeth and then put a bridge in place. And that's what you have, a bridge in place. Or you can do exactly as this, a bridge, and then you place an implant instead of cutting down the two healthy teeth around it. And that's what the implant looks like. Hello?
Yep.
Yeah, so Asha, if we need to add anything on to this from the point of view of all the patients that we have treated over the years.
Yeah, so when we look at aging patients, tooth loss is one of the fallout that happens with time. It's not always a age-related change, but with longevity, what we see is that the tendency towards cavities being more, tendency towards gum issues being more, teeth tend to become loosened and they fall out or they break, fracture away, and it is very important to have a replacement. Now, many a times patients have this kind of feeling that I've just lost one tooth and it doesn't mind, there are other teeth to chew on and all those things. But the minute a tooth is lost in the mouth, there is a loss of function, which at that point, many a times the patients do not even realize about it. There is movement of the adjacent teeth. The opposing teeth may tend to come down. So there is an imbalance. There are gaps created, tendency towards more of food getting stuck, leading to cavities. So the minute there is a loss of tooth or a tendency of the teeth becoming loose, it's very prudent that you visit the dentist and take an adequate counseling from the dentist to ask what is the way forward, because having all your teeth in the mouth is very important from function point of view. It's your ability to chew that is very important, because if you do not chew your food properly, your overall health is not maintained. Because if you visit a physician today, it is not about the medication that they prescribe you for the multiple health issues that you have. It is about having a wellness lifestyle where you can enjoy a diversity of food. They will tell you to have adequate amount of carbohydrates, to have your veggies, your salads, along with the protein. And for that, you need your teeth. So that is the reason why we go about trying to replace teeth. So when there is a fallout, as Dr. Narvekar had mentioned, the best modality is to have a fixed prosthesis back in your mouth, in spite of your health may not be in that great condition. In the sense, today most of our Indians tend to have diabetes, hypertension, cardiovascular issues, osteoporosis issues. But in spite of all these systemic health issues, if your physician has maintained you at a good level, Dr. Narvekar and I, we to work towards bringing about a functional jaw, so that your chewing ability is restored. When your chewing ability is restored, there is a wellness in your mouth, not just in the oral cavity, but your general well-being. And of course, your social well-being. If you have your teeth and you're functionally listening, you're more outgoing, you're more happy and more cheerful. Apart from all of this, the very function of chewing is important from the cognitive aspect. The very act of chewing pushes the blood supply to the brains, and this activates the neurons. And that is why cognitive decline is reduced. One of the reasons of dementia is because of lack of teeth and lack of the chewing power, because that blood supply which is needed for the neurons to remain active also comes from your activity of chewing. So from when we look at all these aspects, it's very, very important that we have teeth in our mouth. So that's what I wanted to add. Is there anything that I need to add, Rajeev?
No, absolutely perfect. That's I think that sets the foundation for questions that people may have for us. Yeah, absolutely.
Great. Thank you. So let me just take the questions. I've received a few questions. So the question which is there is that how long, this is a question from Santosh Garg, how long does the dental implant usually last?
My job of putting it in well and the patient maintaining it well, it can last you a lifetime. Most of these, you look at a success rate of post 15 years. Having said that, there is always a failure rate and a success rate anywhere in the world that you get this done. And it can be, the failure rate is anywhere between 3 and 4%, maybe even less today with the materials and the implant designs that have changed.
This is a question from Madhu Gupta, which is not exactly implant linked, but दांत में कीड़ा लगने पर उसे चांदी से fill करवाना कितना successful है?
Okay.
I think that's for Asha, I think. Yeah.
Yes. दांत में आज के जमाने में स्पेशली इंडिया में चांदी लगाना बहुत कम हो गया है, क्योंकि चांदी का जो फिलिंग है वो एक्चुअली उसका जो साइड इफेक्ट्स रहता है उसके कारण फेज आउट किया जा रहा है. उसके अलावा अभी नए सारे मटेरियल आए हैं दांत के कलर के मटेरियल, जिसको हम कंपोजिट रेजिन्स बोलते हैं, फिर दूसरे ग्लास एनोमर जैसे मटेरियल्स, और कई तरह सिरेमिक जैसे इनडायरेक्ट कैसे फिलिंग्स किया जाता है. तो चांदी के वजह यू कैन डू कंपोजिट रेजिन रेस्टोरेशन जो ज्यादा दिन तक टिकती रहती है.
Right. Another question that has come in is, Doctor, how tricky are dental surgeries? Because when an implant is done, a tooth is being extracted, and I know y'all are masters of the game, but you know, the location of that is all covered up. I generally get scared. I've been advised an implant, but I'm a little worried about that. I live in a reasonably big city called Nagpur, but I'm not very sure whether I have the best dental implant specialists in here.
All cities in Bombay today have implant specialists who are doing a super job. So I don't think that's an issue at all. Having said that, the thing is, today CBCT is available. It's a cone beam CT, which gives you the exact location of the vital structures which are around the teeth that you're missing or tooth that you're missing. And so it's very easy for the dentist to turn around and decipher what bone's available, where it is, how good the bone, what the bone quality is, and for him to remove the tooth and place the implant. So that's really not a problem at all today.
But typically, a dental implant, I remember when I got one done, you know, the extraction itself took a long time.
Yeah, so the extraction takes a lot longer than the implant itself. The implant takes us about 2 or 3 minutes. The extraction may take you up to 15 minutes to get the tooth out. So it's just a question of how loose the tooth is, how much bone there is around, and a variety of things. But that's very, very subjective.
Thank you. We have a question from Shamla Ravi. Sometimes the decayed tooth breaks, leaving the root behind. Is it painful to remove the balanced teeth before a procedure?
So basically, if there's an intact root and the root is sufficient, there are ways to turn around and determine that, but most of it is treated by Dr. Asha, who would then turn around and get a root canal done, put in a post, build the tooth out, and then we place a crown. So you don't necessarily always have to have an implant.
Right. There's a question from Apura Vahta, who is very direct, and he says, what should be the reasonable price of an implant in a good dental clinic or a good hospital?
I wouldn't know what it is in Nagpur at all for sure, but I think it varies depending on the kind of implant system that's used, the kind of materials that are used, whether there's teeth to be extracted, whether there's a bone graft to be done. So, I mean, I'm being honest with you, I'm not trying to evade the thing, but it varies dramatically. So for me to give you an actual figure, I don't think it really makes any sense at all. A lot of these things come into play.
Right. We have a question on root canal, which I'm not going to take right now. This is a question from Shobha Goyal. It says, मेरा सेट बचपन में ही किसी गलत चिकित्सा से खराब हो गया था. मेरा सेट meaning I think his
Her teeth, yeah.
Teeth probably.
सामान्य कोई दिक्कत नहीं है, पर दांतों को साफ करने में दिक्कत होती है. कोई हल? Dr. Narde, this is your.
I think Asha.
तो दे आर सेइंग दांत सेट खराब हो गया था, लेकिन दांतों को साफ करने में दिक्कत होती है। तो इज दिस शी टॉक, आप आपके नेचुरल दांत के बारे में बात कर रहे हैं या डेंचर्स के बात कर रहे थे? अगर दांत आपके नेचुरल है और उसके ऊपर ट्रीटमेंट किया हुआ है तो ब्रशिंग 2 बार करने की जरूरत है। उसके अलावा दांतों के बीच में अगर गैप्स है तो हम उसको इंटरडेंटल ब्रश जो बोलते हैं उसे साफ करने की जरूरत है। धागा जैसे डेंटल फ्लॉस है वो यूज करते हैं। आज के जमाने में वाटर फ्लॉसर करके है, जिस एक बॉटल में पानी भरना है और उसका एक नोजल है जो दांतों के बीच में डाल के साफ करनी है। तो दीज आर द कॉमन वेज जिससे दांत साफ कर सकते हैं। उसके अलावा अगर आपके पास आप डेंचर्स पहनते हो और आप वो सेट के बारे में बात कर रहे हैं तो डेंचर्स को पानी में अच्छी तरह से ब्रश करके साफ कीजिए। और अगर पीलापन आए तो डेंचर क्लेंजिंग टैबलेट्स रहते हैं जो डेंचर को पानी में टैबलेट के साथ आधा घंटे के लिए डाल दीजिए और उससे डेंचर साफ हो जाता है। आई होप आई एम ओके।
There's a question from Rajeev Kumar who asks, what is the threat to sinuses when an implant is done on the upper jaw? What care must be exercised if the upper wisdom tooth is to be implanted?
So two things. The first thing is that we never replace the wisdom tooth at all. All replacements are done up to the second molar and not the wisdom teeth at all. Number one. Number two, the access to the sinus can be established either through a window that's cut on the side or directly when you're placing the implant. So that can be very, very carefully done, and there is no damage that necessarily is caused to the sinus when these procedures are done. It's not a problem.
Right, thanks. This is a question from Shri who asks, for osteoporosis, do you suggest implants, and what is more cost effective, dentures or implants?
So two things. So where osteoporosis is concerned today, a lot of our patients are on a drug called denosumab. The trade name is Prolia and a variety of others. So what happens is they are basically prescription monoclonal antibodies to treat osteoporosis. If you're on these drugs, what happens is they are given every 6 months. You need to wait a minimum of 3 months before you can do any surgical procedure. You run the risk of osteonecrosis if you don't. So you certainly can't turn on and be on any of these medications. Having said that, if it's untreated, osteoporotic patients doesn't necessarily affect the jaws to that extent. It doesn't. So the thing is, you don't necessarily, but having said that, if you're osteoporotic and you wear a pair of dentures, in my opinion, you're doing far more damage, because what happens is the dentures wearing away the pressure of the denture on the bone is far greater, and you will lose much more bone. And at the end of it, you probably will come to a point where dentures don't fit and there is no bone available for implants either. So you need to weigh these things, and a clinical examination is always the best bet.
Right. Doctor, you mentioned about denosumab. Now,
yes.
I do aware that denosumab can also be administered every month or every 3 months. If that is the case, then what should be done?
So the thing is, you need to get onto a program where they will give you that injection every 6 months, because it's an antibody basically that's taking care of that. It's also an anti-cancer drug also that they use nowadays. So the thing is, if you turn on and get those injections done every 6 months, every 3 months, as soon as the effect, because denosumab wears out in the body very, very quickly. So the 3-month period is a perfect time for you to be able to do any treatment. And if you need to get dental treatment, if you're doing a simple filling or something, there's not a problem. But the moment you touch bone, that's when you run the risk of osteonecrosis. It's not that it always happens, but it can happen, and it's not very pretty. So you need to be very careful, and you need to inform your dentist that you are on these medications. That's the critical part, because you'd be surprised how many patients will tell you that they have all kinds of diabetes and hypertension, but they completely forget to tell you about these injections. It's critical, absolutely, that you're informed about it. So we now routinely ask all our patients, are you on any kind of osteoporotic medication?
Right.
Can I add something over here? Ideally, any patient getting onto this medication, be it an injectable or a tablet, should visit a dentist, get a dental clearance done before you start with the medication, because many a times it so happens they start with the medication and in a couple of weeks they land up with some unforeseen infection where extraction is difficult and doing any surgical procedure for that matter is difficult. So those kind of patients are put on antibiotics till such time there is a free window where there is a drug holiday, and then the extraction or surgical procedure can be carried out safely. So
Yeah,
please visit a dentist before you start with the medication.
yeah, that's a great point, Asha. Yeah, absolutely. Yeah.
There's a question from Shobha Srivastav from Delhi. I have a bridge. How long will it last? Doctor denied an implant. According to him, my bones are very fragile.
Okay. I'm sorry, these are subjective. It's very difficult for us unless you see the x-rays and see the patient that you would determine what can be done and what can't be done. The average life of a bridge is about, if you look at it, this thing is about 7 years. But 7 years would depend entirely. I mean, we have had bridge work in the mouth for the last 20 years and 25 years, and it's still going strong. But that also depends on the quality of the teeth and the life of those teeth below the bridge. That's critical. If they've already decayed, if they're not in good condition, it may be even less than 7 years sometimes.
So there's a question from Shri, which I'm not very sure what he means, but the question, I guess, is if for an osteoporosis, somebody who has osteoporosis, can you have a tooth removal with ease?
Of course you can. That's no problem. That's exactly what Dr. Asha was saying. To come back to it, please. Asha?
Yeah. See, any person having osteoporosis and not on medication, there is no problem in removing it. But as a dentist, you have to inform the doctor that whether you're on a medication or not. Now, if you're on osteoporosis and you're on medication, that is when it is very critical, because that's when, if you're on a tablet or on an injectable form, you need to have the medication in a safe period. We need to do it. Suppose you're taking the injection, you need to wait for 3 months, then the extraction is done. Ideally, before the second dose of the medication is given, 4 weeks before that is ideal that you visit the dentist. If at all the dentist feels that any tooth has to be preemptively extracted or a surgical procedure has to be done, it is safe to do it at that time. But if they are not on any medication and they have osteoporosis, absolutely no problem in extraction.
We have a question from Sushma Agarwal, who says, "मेरे चार जार root canal, sorry, मेरे चार जार root canal हो रहे हैं. One implant हो गया है. अभी 2 और करवाने हैं. Should she get it done?"
That's not a problem if it is required. अगर आपका डॉक्टर ने आपको बताया है कि रूट कनाल और इम्प्लांट करने की जरूरत है, numbers is not a problem. आप सेफली करवा दीजिए. The whole idea of doing root canal treatment is आपके जो नेचुरल दांत है वो बच जाएंगे, जिससे आपको आपका फंक्शन लौट आएगा.
There's a question on wisdom tooth from Rajeev Kumar. Is removal of wisdom tooth difficult? Do we need a specialist surgeon to handle it?
Yes. So the wisdom tooth, basically you need we refer all our third molars, which is the wisdom tooth, to an oral surgeon who comes and takes care of it, because they do it on a routine basis. That's the critical part. Also, an X-ray and a CBCT, as I mentioned earlier, will tell us how much bones around the roots, whether the roots are curved, whether if the tooth is horizontally placed, that gets a little more difficult. So as long as you go to a trained oral surgeon, I think it's not a problem at all.
Right. To the question that we had, you spoke about, Dr. Narde, you said, so she asked, do you mean every time before taking Prolia, we need to meet a dentist? Am I correct?
Yes. So normally Prolia is given for 3 years. That means 6 doses of injection. So the patient knows when every 6 months he or she is supposed to be taking the medication. Ideally, 4 weeks before the injection is done, please visit your dentist, get a dental checkup, get a cleanup done for your teeth. If there are any extractions or root canal treatment, or if there's any procedure to be done, please complete it and then only go ahead. Because why I say 4 weeks before the injection is that, so there is a healing after the procedure is done before the injection is taken.
Right. This is a question which I've asked in the past as well, but for people who have comorbidities and who have other ailments, is it advisable to do an implant surgery in a hospital, or is the clinic fine?
So we do what we do at Breach Candy is basically we treat patients under sedation, mild, very, very mild sedation, in the sense the patient's actually talking to us while the procedure is going on, but they are just slightly sedated. The advantage of that is we have a medical grade anesthetist with us who will be monitoring the patient for everything for the patient, number one. And number two, it also any apprehension from the patient's point of view is taken care of because they are mildly sedated. The procedure is done, 15 minutes later, the patient walks out of the clinic and goes home. So having said that, all these procedures, if there are comorbidities, can be taken care of as long as you recognize them before, treat them before, and then do the surgical procedure.
So for somebody who is, in another city, would you advise them to go to a dental facility in a hospital, or is a dental clinic fine?
No, it also depends, Mr. Maheshwari, on whether it's a single implant that needs to be done or you need to do multiple, because we do, between Asha and me, we do a lot of full mouth cases, which are basically either with root canals and bridge work, or I do them with implants. So the thing is, with those full mouth cases, when you're taking out a number of teeth at one time, placing 6 or 8 implants at the time, perhaps you want to do this in the hospital if the patient has comorbidities, only because of the amount of anesthesia that you need to administer to the patient, the local anesthetic that I'm talking about. That's critical part, because it has a drug or adrenaline, which can be, if the patient is on blood pressure medication or anything else, is all taken care of, because the anesthetist is monitoring the patient at every step of the way while the procedure is being done.
Great, thank you. We have a question from Smita Verma, who asks, how is heart health related to teeth health? Is there any relation between heart health and dental health?
Yes. So studies have shown that the bacteria that are there in the gums, say for example, you have gum disease, the number of bacteria in the gums are way higher. So that bacteria which are present in the gums via bloodstream can go and affect the heart tissue. So that is why a patient who has comorbidities, it's very important to get cleanups done regularly, so that the bacterial count or the germ count that is there in the gums reduces considerably, and it does not enter the bloodstream and cause not just heart issues. If a patient has bronchial issues, the chances of pneumonia are way high. So also patients who are diabetic, if the gum health is not good, there is always a chance that your sugar levels go high. And the same time, if your sugar levels are very high, your gum health also is not in a great shape. So there is a correlation between your gum health and your general health, because these are studies and scientifically proven studies.
Right. We have a question from Sunita Verma again, who asks, can patients on blood thinning medicine also go in for tooth implants?
Yes. So what we do, that applies to any surgical procedure that you need to do. Of course, you can place implants. What we normally turn around and do is we have the patient off the medication for 4 days, only after we have spoken to the physician involved who's administered them the blood thinner. Basically, the cardiologist in most cases. They need to confirm and get us a written report that it is fine for them to stop the medication of the blood thinner, and then we take care of the surgical procedure. The next morning, they start the blood thinner again. So it's not a problem. And having said that, there are certain patients who can't get off the medication at all. In that case, we turn on and place the implants, do all the surgical procedures, advising the patient that there will be a sufficient amount of bleeding for that, for the day or whatever else. And then it settles down over a period of time. But sometimes it can be a little unnerving for the patient when they are on strong doses of anticoagulants, because there are a number of these drugs today which are much stronger than the conventional aspirin that you give them.
We have a question from Mr. Jamunathan, who's 78 and lives in Bangalore. He says, when a person is taking vitamin D tablets, is it a contraindication for dental replacement?
No, I don't think it is at all. Asha, sorry.
No, there's no contraindication if you're taking vitamin D tablets, as long as it is vitamin D and calcium. Sometimes there are physicians who tell patients that I'm giving you calcium supplements. They are based, and they give you these osteoporotic medication for osteoporosis, because they try to ease it and tell the patient, if the doctor tells the patient that I'm going to give you denosumab, sometimes it doesn't make sense to the patient. So they say, we are going to give you calcium kind of an injection. So be very clear with your dentist that which medication, whether it is actually a vitamin D medication or some related component is there, please share your prescription with the dentist and then only go ahead with the procedure. But by itself, vitamin D and calcium, there's no contradiction at all.
Right. We have a question from Sharda, who says, I had a dental problem and the doctor saved some of my teeth, which and did permanent dentures, which lasted for 10 years. And then again, I had pus formed in one of my teeth, and then root canal was done for all teeth. After saving some of my teeth again, permanent dentures have been done 2 years done. How could I save my teeth from getting further problem?
Regular dental checkups, regular cleanups. Pus formation is when the gum health is not good. So the minute you get regular cleanups done, the bacterial count goes down and the tendency towards a pussy pocket is less.
So how often should anyone do a dental checkup? What is your advice for senior citizens?
Ideally, once in 6 months. But for patients who have multiple comorbidities, patients who have dry mouth, patients who have burning mouth issues, I would say please visit your dentist once in 2 to 3 months, because those are issues, which need to be checked regularly by your dentist. Say, for example, you have dry mouth, the tendency towards cavities is way high. So a routine checkup, like how you would go to a physician, would be better in such situations. Otherwise, once in 6 months is good.
Right. We have a question from Bomi, who says, I have a partially broken wisdom tooth, but it is not any trouble to me as I go regularly for teeth cleaning and brushing my teeth twice daily. Is it okay to leave it as it is?
Absolutely. If it's giving him no trouble, he should just leave it there, because it will involve another surgical procedure to take out the balanced tooth. So if he doesn't want it and it's not bothering him, the only thing is the dentist has to check with a small x-ray whether it is in fact there, because what happens is some of these teeth, if they're broken half, could turn on and form an abscess, at which point it will become a bit of an emergency for him to have it removed.
Right. Now, this is a question which I'll read it out. Some dentists do implant screwing by judgment rather than any technology guidance. For two adjacent implants, the screwing is not exactly parallel with 10 degrees variation in angle. Is that okay?
Absolutely no problem at all. There are things called abutments which you connect onto the implants, which can correct an angulation all the way up to 30 degrees. I'm not suggesting that they do that, but by the same token, there are certain anatomic situations which don't allow you to place implants, or place implants in areas which would naturally suggest that you need to place that implant at an angle. So even if it's up to 30 degrees, there's no problem at all.
Great. Thank you, doctors, for this amazing session. We've answered quite a few questions. 24 questions we've answered in these.
I can see many more in the chat box.
Yeah, which I've kind of kept for
Another
session with you, Dr. Narde, which is off implants. I thought it's good to restrict ourselves to implants only in this session. Thank you once again, Dr. Narvekar, for being here.
Thank you so much, Mr.
Thank you for taking time on a Saturday evening. And thank you, Dr. Narde. I know I can see you are at your clinic. So we are kind of taking you away from your patients. And one always feels a little guilty about that. But once again, thank you very much for being here and for being part of our Health Live movement, as we say, to empower senior citizens on their health situations. We will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. Once again, thanking Dr. Narvekar and Dr. Narde for being here. Thank you.
Thank you so much, Mr. Maheshwari. Thank you.
Thank you for having us. It's always a pleasure to interact with seniors today.
Thank you. Thank you.
We'll do sometime in October, International Old Senior Citizen.
Yes, we will. We will.
Yeah.
Okay, can we contact doctors? Yes, you can. They are there on the internet, and we will have their coordinates on our takeaways when we publish them on Monday evening. Thank you.
Thank you. Thanks.
Thank you. Happy weekend, everyone. Bye, Rajeev. Bye, Mr. Maheshwari. Yeah.
Bye.
Subscribe now and press the bell icon. Never miss an update.